not in a health way only, like coming on the political level also. Like I found it like a space also to send the message, the Palestinian message of what's happening here on the health situation, on the health sector, like to try to advocate on these issues on the international level. Like the members of the network, they could contact the organizations in Palestine, who could open this network to work more on the situation outside, like to have solidarity for the Palestinians. It's not only about humanitarian. For sure we need this kind of work in Palestine. We need hospitals, we need projects to do all this. But at the same time, our case as a Palestinian is political before it's humanitarian. On the other hand, like this kind of work, we could do it together, like opening this relation to know what's the needs and what like the picture that we would try to send it. And this is what we have lost in it, like how to use the media about the situation in Palestine, and especially on the health issue. Maybe your colleague who will talk more about the health issue, not the political level.
Dr. Raoul, you think the mission?
Yes, as Aisha said, we work together in the National Health Council here in Palestine, and we are 4 groups of health provider. The major one is the Ministry of Health, the other part is the NGOs, the third one is the UNRWA, and the fourth one is the private sector. But what we need is sustainability in the healthcare. We can't talk about sustainability without the infrastructure. You know, 40 years of occupations was without any developing or building an infrastructure in medicine. So since 1995, the Ministry of Health, the health NGOs are working together to build that. There is now a good amount of infrastructure already existing and fighting against all the movements of the occupation, destroying this infrastructure and letting us always looking for a new alternative. How can we continue existing? Normally, when you have Ramallah and Bethlehem, a distance of 20 kilometers, you can make a big medical center in Ramallah. It will serve the whole area between Nablus and Hebron. But with the wall, with the alternative routes, with the checkpoints, it is not possible for emergency medicine to have the big centers in Ramallah, and the other people will die before arriving to the center. So we have to have a mini or a micro infrastructure in each city, providing the help. It is a great help when surgeons or expertise came from outside. They give a help for 1 week a year, but the other 51 weeks, what should happen? So we are thankful for the help. I get many teams from Germany, and we are expecting a team from Italy in the next period of time. But what we need is sustainability. People who came to help us here, teaching our personnel who are working in hygiene, in TQM, in all the different things, so that we have the capability and the possibility to serve the people in the periods after that.
Question.
Okay?
Right, it's just basically to revisit, recap.
Anything new what we just said?
Just to reiterate one point via the idea of a conduit from outside within is hopefully to include the other way around as well. I'd like, for lack of another term, to call it telemedicine, to be able to have the means of a structure. That's where I see the mission of the network, being able to establish a structure where I can get the outside to look in without coming here, through the whole idea of telemedicine. We can elaborate on that later on. But education and clinical work is...
There is a telemedicine project starting.
Professor Green, is it?
We have one in Beit Sahur already.
Yes, I've
Yes.
got it in diabetic in retinopathy aspect.
I have specific question for specific people. Carlos, specific question. What you can do for the Palestinian network health sector? What you can do as
But wait,
you?
wait, excuse me.
Yes.
I want to add some,
Yes,
some
go
things to the mission of Palestinian
Sure.
Network. I will talk about the mission of the Palestinian Network, but in the whole proposal, not only medicine. I think the mission is to get the bad situation that we have here in Palestine to make it in an advantage, because
Make it what?
advantage.
Advantage, yeah, to the advantage to the.
Because all of our people is most of our people is in the diaspora, and we are in our countries the best professionals in all areas. You can see that in Chile. Chile have the best professionals are Palestinians. So this is the way the Palestinian Network should be a vision in the outside, to bring all these good, organize these good professionals and bring to Palestine this professional advantage and make Palestine the best in all areas. That's the way I think the mission in Palestine Network should be focused. Huh?
But what you can do as Carlos?
Well, as me, you say, as my knowledge as professional, I have a lot of projects in my mind of, for example, improving public health, improving all the prevention stuff in food, because we veterinarians we are focused very much in the sanity of the food, you know, food inocuity. And that's I think, well, I have projects too in, for example, public health, to promoting the use of bicycle in the cities, because they are cities here are tiny. So, and I see they always use the car. Why don't use the bicycle? You don't should import oil, lubricant, vehicles, nothing, and the health of the people will be better. Well, here, maybe here not, because there are hills and everything, but other cities.
They don't have this on the program.
Yeah, but this is a work in long time.
I work with the Palestinian community in Chile, and I note that the refugee, las personas, los refugiados que llegaron a Chile, los refugiados que llegaron a Chile,
The refugees that came to Chile.
right? The children haven't a good health,
dental
their mouth,
hygienic, yes.
a lot of decay. Even if they don't open your mouth, I can see that. So that's sorry. And
So preventive medicine.
okay,
She
because
is a dentist,
because
I think. Are you a dentist?
I am
She's
dentist.
dentist.
I'm dentist. My father is traumatology, right? The word traumatologist, and he really speaks Arab, but he never have the tools to come here. The dream of my father is my dream too. I want to come here and work like volunteer, because it's the thing that I can do. I'm not
Politician.
No, maybe if all the Palestine are out of Palestine, come back here and give a little thing that they can do, we can
change the world.
No, a little different.
bit, yeah.
But the mouth is so important, and the people forget that phonetics, nutrition,